COVID-19 is now a fact of life in the United States and here in Charlotte as well. And people are trying to adapt to what is a new normal, trying to get their life going again. And as summer approaches and we hear that restrictions are easing across the country and here in Charlotte, people are looking to travel plans, summer plans. Is it okay to have a barbecue in our backyard? Can we have some friends over for a movie night? Can we take a vacation to a beach house on the coast, or to stay in a hotel somewhere up in the mountains? These are all normal summer activities, and this is not a normal summer, so we have to adjust our practices a little bit to accommodate what's going on outside during this pandemic. So as the illness has, our understanding of the illness has progressed over the last few months, we've gathered data, we've tracked sick people, we tend to have a better understanding of how they're getting sick, and we can hopefully pass that on to our patients and give them guidelines to put that knowledge into practice. One of the things we're learning from this illness is that being indoors is a high-risk situation. Now, I'm not talking about going inside a grocery store for 10 or 15 minutes, walking around, doing your shopping and leaving. Believe it or not, that's probably not such a high-risk endeavor. I'm talking about being indoors with other people for a length of time, especially if there is activities going on that causes deep breathing, whether it's exercising at a gym, whether it is singing in a choir or in church, or yelling and laughing. I'm not even mentioning the coughing and the sneezing. If you're coughing and sneezing, whether it's allergies or not, you probably should be at home or avoiding those situations altogether. But if you are planning on venturing outside the house, it's helpful to know what are higher risk and what are lower risk situations. So as a rule, the more people are congregating indoors for a longer period of time, the more at risk you are for getting an infection from somebody who may be infected themselves but asymptomatic, not having any outward symptoms. And examples of that might be a religious congregation indoors where it's going on for several hours. You're sitting, even if not shoulder to shoulder, if there are 50 of you inside and you're singing, that's a risk factor. Attending a theater, even though you're quiet, it's just the proximity and the duration of time you're there that puts you at risk. Even going into a restaurant, as restaurants start to open back up, that may be a problem, because a restaurant that's only at 25% capacity still may have 20, 30, 40 people in an enclosed dining space, and the diners are there for an hour or more. It's the time plus the exposure that leads to the potential for infection. Outdoor settings, probably not as bad. Outdoor on your patio with a couple of friends, or maybe even 5 or 6 friends. If it's outdoors and you're there for an hour or so, the ventilation is literally limitless, and so the infection risk in that situation is much lower. So what about some of the examples I mentioned earlier? Going to a beach house, let's say, on the coast, as opposed to a beach house in Kansas, I don't know. Going to a vacation house on the coast, if it's just your family and maybe even another couple, probably a pretty low risk situation. It's just you and you're with known entities, your immediate family. It's really not much different than sequestering in your own home. And the rest of the time you're outdoors because you're at the beach typically. Going to a hotel room and staying in a hotel. Other than wiping down the remote control with an alcohol swab, alcohol wipe, which most people do anyway, maybe folding the bedspread back, which most people do anyway. Being inside the hotel room itself, not a major risk. The risk that you will incur in those situations is getting on the elevators, being down in the lobby, or the bars or the restaurants that are affiliated with the hotel. And that might be a higher risk situation. barbecue on the back patio. I think I already alluded to having some friends. How many people is too many? Again, it depends on your space. It could be 20 people, but if it's a large outdoor setting and there is not a lot of yelling and screaming going on, probably okay. The one thing to watch out for, though, is your alcohol consumption, because we all know that alcohol makes you louder, makes you more social, and puts people in closer proximity to each other. And so you have to be careful that even your best laid plans may go awry if there's a lot of alcohol consumption and your judgment is impaired slightly to the point where you're not observing some of those social distancing guidelines. So coming back into the summertime, there are a lot of activities that we can engage in that bring back some sense of normalcy to our lives. You just have to be smart about it and have some notion of how this virus is spread and how to avoid those situations. If ever you have a question about a specific situation, that's what your doctor is for. We can help answer specific questions. If how many people is too many people, how small of a space is too small of a space, or what duration of time is too long. I mean, these are a lot of moving parts. And if your doctor tells you they can lay out some algorithm that you can follow that will keep you safe at all times, probably doesn't have a pretty good grasp of what's going on. It is going to be a case-by-case situation, and it's something that you should discuss with your healthcare provider.